Thank you, Mr. Chairman. As you know, the governor has issued a state of emergency here in North Carolina, and we are currently in Mecklenburg County. We are following the guidance of the state of North Carolina as well as the CDC. We have no cases, no active cases in Mecklenburg County. As we know, that can change at any minute. And we are following the guidance, which basically says the decisions you make are based on the epidemiology that you have on the ground. But we are doing a lot of preparedness work. Today, we will be activating our Emergency Operations Center in conjunction with Emergency Management. We have been holding daily calls with Atrium, Novant, CMS, Medic, Emergency Management, and the city manager to talk about messaging and making sure that we are aligned in terms of the messaging and information that we give to the public. We are reaching out to long-term care facilities because we know the state has indicated new guidance that visitation should be limited in all long-term care facilities, and so that is something that we are looking at. We are also reaching out and working with our homeless providers to understand the implications of any of our homeless neighbors who may need medical care. We're also working with our child care providers, understanding their preparedness and making sure they have what they need as a preparedness in our detention facilities, and making sure that their contractors are doing elevated cleaning and sanitizing in the detention center. There's been a series of meetings between the hospitals as well as the health department and emergency management around process and communication. We think these are two very critical components to this, is that making sure that processes are clean and that they're tight, so if we do get a positive case, which we think eventually we will, we understand exactly what happens to that person, understanding if somebody's been exposed, who that is, how they get tested, and what that process is going to look like. So we've done a series of what-if scenarios to make sure we understand that, and making sure, again, that we're communicating to the public in a very coordinated fashion. In terms of internally, and we are in the process of obtaining and deploying laptops to those people who we believe will continue to have to provide service in the event that they cannot come to the office, so we're working on that. We are also looking at services that serve seniors, so making sure that in the event we need to, we will discontinue services that serve seniors and look at opportunities to provide alternative services to seniors. So if that's congregate feeding sites that we have, senior nutrition sites, if we have to have home-delivered meals in lieu of them coming to our sites, as well as trying to provide online recreation opportunities for seniors in the event that that's something that we need to do. We are increasing our janitorial services at all of our facilities, installing hand sanitizers on the walls. We're also looking at opportunities at facilities in the event we have to do isolation, be appropriate for that in the event that we need it. And we're also looking at what we would need to do in terms of capacity and process in the event that we have to do community-wide testing. Again, we're not there yet, but we certainly want to be prepared. There's been a lot of discussion around this whole concept of social distancing. Should we cancel large events? Should you not go to large meetings? We, at this point, have taken the position that we do not have any cases in Mecklenburg County. And in the event that we do have a case, we'll make decisions then. So at this time, we are not recommending that large events be canceled. People have to make a personal choice. So if they have a choice to go to an event, they can choose not to do that. But at this time, we're not making any recommendations around social distancing. But again, we will keep people updated as the guidance changes or the situation on the ground in Mecklenburg County evolves.